Hey, this is Dr. Ankur Prakash from Living Well Balanced. Enjoy this amazing video by our all-star physician assistant, Joshua Corwin. In today's video, he's going to be sharing with you all the amazing insights, the gems, the benefits of regenerative medicine. To learn more about chiropractic care, the benefits of medical massage therapy and the IVs and everything natural that we do in our office, please make sure to subscribe to our YouTube channel and definitely click the bell. That way you'll be notified when we get our new video out.
Hi everybody, it's Josh Corwin, Integrative Physician Assistant here at Living Well Balanced in Raleigh, North Carolina. Talking to you today about a part of our regenerative medicine offerings here, specifically what is called Wharton's Jelly. Wharton's Jelly is a jelly-like layer that cushions the blood vessels that are found in umbilical cords. And at Living Well Balanced, we work with a lab facility that speaks and consents with moms during their pregnancies. Moms who are having planned C-sections are screened and consented during their pregnancies to provide the Wharton's Jelly from the umbilical cord after the baby is born healthy. Once the umbilical cord layer is no longer needed, what for a very long time was considered to be medical waste without practical applications was discovered and researched to be really a game changer in the field of regenerative medicine. In the field of regenerative medicine, you may hear people talking about stem cell therapy. So we know that Wharton's Jelly is a potential source of stem cells, particularly the kind that are undifferentiated or have the potential to become whatever they need to become. In the field of regenerative medicine at Living Well Balanced, we are trying to offer the body a potential solution to regrow tissue that may have been damaged. We see patients who have been diagnosed with osteoarthritis. We see patients that have been diagnosed with tendon or ligament injuries. We see people with chronic pain conditions who all have had positive responses to Wharton's Jelly. When we use it in a hip or a knee or a shoulder or other significant size joint, the technique is virtually identical to the technique for providing a cortisone injection or an anti-inflammatory injection that most of our patients have gotten at some point prior to being seen here at Living Well Balanced. The injection itself is fairly quick, sometimes taking as little as 5 to 10 seconds, and is fairly painless, also with most patients describing not much more than a little bit of pressure in the affected area. Our most sincere hope with administering and providing Wharton's Jelly injections are patients are going to have an improvement in their symptoms. There are multiple academic institutions performing double-blinded studies currently. There are also compelling case reports out there where nearly every single person that has received Wharton's Jelly injections for the aforementioned areas have had significant improvement in their pain scales and satisfaction outcome scores. Some of the double-blinded studies right now are trying to prove what much of the anecdotal and retrospective analytical evidence seems to indicate, which is that Wharton's Jelly has significant promise in the fight against arthritis. Some of the other benefits of Wharton's Jelly is that it is very rich in TGF-beta, which is transproliferative growth factor, as well as VEGF, vascular endothelial growth factor, which are really important cells and proteins in formation of scaffolding or building of tissues. Many patients very understandably ask if there's insurance coverage for Wharton's Jelly. Sadly, as of the time that I'm recording this video, there is not. We are hopeful, or I am very hopeful, that the compelling anecdotal evidence and the case reports and the day-to-day experience with Wharton's Jelly, in which so many of our patients have received benefits, will be combined with the ongoing clinical trials and research, and that's coming down the pike. But for the time being, this is not covered by any insurances, including Medicare. So I mentioned earlier that the procedure itself is relatively quick and relatively painless. People ask often, well, what are their limitations? Do I need to be non-weight bearing if I've had an injection in a knee? If I get Wharton's Jelly injected to my shoulder, do I need to be in a sling? The answer is no. The answer is that you are immediately cleared after your injection for typical day-to-day activities. We ask to limit impact if you're having Wharton's Jelly injected into a knee. We ask that you perform walking and stairs as needed, but you limit side-to-side pivoting, impact activity, deep squats, for a period of about 6 weeks. Similarly, if you're having this for your shoulder, we ask that you avoid the endpoints of deep motion and deep resistance, but certainly you can use your shoulder for everyday activities as needed. The answer to how long until somebody will feel better or notice a difference is variable. I had a woman who had anterior or front-sided knee pain chronically since her 20s with evidence of osteoarthritis on both her x-rays and an MRI, who had had cortisone injections and physical therapy, who I performed Wharton's jelly for. And I saw her the next week and said, "How are you doing?" And she said, "I am 100% pain-free and I'm ready to do the other knee." And I kindly suggested that I thought that may have been the placebo effect, or that maybe she was just wishful thinking here, and that it was probably a little bit too soon for her to have any relief. And she responded, "Josh, I've had this pain for 30 years, every single day. My knee was crunching. It's not crunching anymore. There's no more clicking. There's no more popping. I feel 100% relief in my knee, and I'd like to do the other side today." And I said, "Okay, well, who am I to argue?" And so we went through the consent process and talked about her other knee as well. I injected her other knee, and 1 week later that knee stopped hurting as well. And I just saw her a few weeks ago, just shy of the 2-year mark since her round of injections, and she has complete resolution of her pain and is out running again and performing full activities. And so I think of that as a little bit of an outlier, but we've had plenty of case reports and plenty of real-world patient experiences where there has to be more significant factors than simply the placebo effect at play. I typically tell most patients to expect about 60% of their gains within the first 6 weeks or so after their injection, probably about 85% of their gains by the 3-month mark, with potential for continued improvement up to a year after injection. Again, there's no guarantee, there's no promises here, but everybody that I have treated with Wharton's jelly has had a positive response here.
Thank you so much for watching our video. If you got a gem or two out of it, please make sure to like it and share it across your social media. If you haven't subscribed to our YouTube channel, please make sure you do that, and definitely hit the bell so that way you get alerted every time we get a new video release. Speaking of videos, we got 2 great videos right here.